We've actually got the spokesperson for the American Academy of Pediatric Dentistry, Dr. Mira Albert. Hello.
Hi, thanks for having me.
I'm so happy that you're here. So she has some tips and advice. Welcome to the jam. Let's actually dive right in here. Okay. So when should you start taking your child to the dentist?
Okay, so most people are actually really surprised to know that you want to start taking your child to the dentist by their first birthday to establish a dental home. Yes, absolutely. Tooth decay remains one of the top chronic infectious diseases in the United States year over year. So it's really great to establish this relationship so that you have a pediatric dentist who can give you tips and tricks on how to prevent tooth decay.
Oh, wow. And so when should you start brushing their teeth if they're going to the dentist at around 1?
Great question. So I think it's great to begin brushing your child's gums even before they have teeth at bath time, just to get them acclimated to having the toothbrush in their mouth. Okay. Once they actually have teeth, it's really important to brush their teeth 2 minutes twice a day. And you want to do this until they're about 7 or 8, and then you can kind of relinquish control and supervise them after that. Tooth decay is nearly 100% preventable, so this is a great way to establish these great oral hygiene routines.
And these are questions you don't always think about when you decide to have a kid. Like, when do you start using fluoride in their toothpaste? That's a harmful chemical at a young age?
No, actually, fluoride has been shown to be one of the safest and most cost-effective ways to reduce cavities in children. So we actually recommend at the American Academy of Pediatric Dentistry using a smear of fluoride-containing toothpaste as soon as you start brushing your child's teeth, and then upgrading that amount to a pea-sized amount when they're a little bit older and they can spit, usually around age 3 or 4.
Okay, so use a little bit. That makes sense. That makes a lot of sense. So we talked about when you should start brushing their teeth, getting them used to just having the toothbrush around and going through the process. What about flossing? Because I know you're supposed to do that every day.
Yes, absolutely. So if you're only brushing your teeth, the bristles cannot reach between the teeth where the teeth are touching. So you actually do want to floss your child's teeth as soon as those teeth are touching. And again, you want to help your kids. And I realize that it's hard. I have my own children. I remember fighting through those toddler years. But remember, it's all about establishing great oral hygiene habits beginning really, really early for 2 minutes twice a day, and cleaning out those areas, getting the plaque and the bacteria and any food that could be stuck between the teeth out from in between with the dental floss.
Well, you're the doctor. You get to say, listen to me. I'm not mom. I'm the doctor.
Exactly.
I said so. And then this is actually a really good question. Is it necessary for me to spend money on fillings for baby teeth knowing that they will fall out soon? So if the baby teeth have a cavity.
Yeah, so this is a major misconception out there. Baby teeth actually do matter. They do provide the foundation for the permanent teeth that come into the mouth. And if you leave cavities untreated in children, it will lead to pain and infection. Children lose so many hours of school, and parents lose time with work treating these cavities. So it's really important to actually treat the baby teeth and keep children nice and healthy and out of pain.
Okay, speaking of our baby's teeth, our baby's baby teeth, we actually have just some of the things that might be common if you have a child, some of the things that you might even have in your diet. So I know a lot of people do try to stay away from pop, but there's also a lot of sugar in the juices as well.
Yeah, it's shocking to see that, you know, a lot of the juices have nearly as much sugar as some of the sodas. And so it's really important to stay away from these things. I actually recommend in my own practice that kids drink plenty of water throughout the day and milk at mealtime, and try to avoid drinking these things that are loaded with sugar and acid that can really do a number on teeth and cause cavities. Additionally, I think it's important to make sure your kids aren't grazing and offer healthy, low sugar, low carb snacks such as carrots and or cheese sticks.
I think that's what gets people into trouble. So a lot of parents, they try to do the 100% juice, but even natural sugar is still sugar.
It is still sugar.
And that juice has the acidity in it. That's something actually I need to think about. The juice has the acidity in it.
And another big thing to note is organic doesn't necessarily mean healthy. And so oftentimes, you know, people lean toward the organic snacks, but the bacteria in your mouth cannot tell the difference between an organic, say, fruit snack or pureed fruit pouch and their non-organic counterpart. And so you really want to avoid frequent grazing on those kinds of things, and instead reach for the fruits, the veggies, cheese sticks, things of those things.
There you go. Doctor's orders, you guys. Stay away from the snacks and the pop and the juice. Go with water. All right. You can learn more about dental health care at mychildrensteeth.org.